Hi everyone, my name is Shawana Tabassum and I am a very new assistant professor at the University of Texas at Tyler in the US. Honestly, I was not even born when the Berlin Wall fell on November 9, 1989. But who knows, maybe the nature was already preparing for people like us who would one day break walls and barriers. As a child, I always wanted to be a change maker. I grew up in a society where women are acknowledged for being a good housewife and a wonderful mom. I always wanted to change the scenario, and that's how I became the first woman in STEM in my entire family. If you want to change the world, start from your home. That's exactly what I did. I inspired my own sister and my female cousins to pursue career in STEM disciplines. Now, as an educator, I inspire my students. As a working mom, I inspire other fellow working mothers, and finally, through my research, I'm breaking walls. So, yes, definitely my wish came true. My research breaks the wall of neonatal health disparity. If we first talk about the existing challenges of the current tests, which are available in developing countries such as South Asia and African countries for monitoring sepsis, jaundice, and hypoglycemia in infants, then we will see that first, there is a delay in diagnosis and treatment, such as 18 hours per protein test and 72 hours per culture, thus creating a huge gap in the treatment pathway. Second, some of the protein tests, such as PCT, which is a key biomarker for sepsis, is not even available. Third, cost, and this is a big problem, such as $11 per culture, more than $30 per lab test, and even $60 per day stay at the NICU, which is not affordable to poor people. Fourth, a large volume of blood is required to run these tests. Now imagine a preterm baby who only has like 32 mLs of blood running through its entire body, and the current tests require more than 2 mLs of blood draw each time. So it's a huge issue. Fifth, complex implementation. So only trained personnel can run these tests. Now, think about a remote clinic or war zone. Then what will happen to the neonates born in those areas? They will be just left to die because of the lack of trained personnel who can run these tests. And finally, portability issue. And that's why the current devices cannot be portable and cannot serve the under-resourced areas. So these are some real pain points which I identified from the physicians of developing countries, and it is these problems which create this huge wall of health disparity between the developing countries and developed countries. So, our solution to this problem is a rapid, cost effective, and point of care diagnostic device that we have already developed and patented for monitoring sepsis, jaundice, and hypoglycemia in infants. Currently, we are in the stage of running pilot studies. Now, the question is, how will this device break this wall of health disparity? The innovation of my research lies in how the device will break the wall of health disparity. First, it provides rapid detection in less than 10 minutes as opposed to up to 18 hours required by the current tests which are available in developing countries. Second, using a single device, we can monitor all the major biomarkers of sepsis, jaundice, and hypoglycemia. Third, only a single drop of blood is required to run the test as opposed to more than 2 mLs of blood needed by the current test. Fourth, it's affordable. The estimated cost of the reader is $50 and each strip costs $5. The reader is a one-time purchase. We just have to change the battery over the time and the strips are disposable. Fifth, it's very easy to use. We just have to prick our finger, draw a drop of blood, put it onto the disposable strip and insert the strip into the reader and boom, we get the result in less than 10 minutes. And finally, the device is portable, so the tests can be run at the bedside, even in a doctor's chamber, in a remote clinic or even at the war zone. My son was born preterm and had hypoglycemia at birth, which inspired me to do something big for the society through my research. Our rapid, cost effective, and bedside diagnostic device will save millions of lives because the doctors can get the result in less than 10 minutes. It will also be a lifesaver for the preterm infants because of the need to draw a single drop of blood, and the device will be affordable to underserved communities, which was also identified through the customer discoveries that I did as part of NSF's ICOR program. The question that still keeps me awake at night is how to overcome the social barriers, like how to make the people, the communities, the administration of the underserved areas aware so that they adopt a new technology.